information. But this is really our first kind of climate COVID commonality. Emissions are falling, air pollution is easing, all of these things have net benefits for human health, as well as the ecological health of the planet. And there's certainly a recognition here that when we're prompted, we can have very interesting net positive benefits on the environment. And so certainly there's a bit of a recognition here that climate change and COVID, they're both global in scope, but they're going to manifest uniquely based on local context, right? It's are certain local criteria that's going to define our response and our ability to deal with not only COVID, but also climate change in terms of our level of preparedness, our demographic composition, the proportion of people who have pre-existing conditions, and so forth. So that's the good news. And a recent analysis has actually suggested that at the height of our kind of physical distancing measures and kind of around April, we experienced about a 17% reduction in daily CO2 emissions. This was labeled the most significant reduction in greenhouse gas emissions since the Second World War. The challenge with this kind of good news situation is that we know pre-COVID, we were roughly tracking the business as usual high emission scenario reported on by the IPCC. And so that this COVID pause in emissions is likely and was always likely just to be a blip as leaders around the world race towards the goal of even what our own Prime Minister Justin Trudeau labeled, quote, bringing the economy roaring back. Well, I would argue that without suitable foresight, this is kind of the trajectory that we're roaring towards is actually one of climate calamity. And it's this kind of deep coupling between the net environmental benefits of implementing physical distancing measures and the slowing of economic activity that's really kind of indicative of how all things in complex systems are related. And you can already see that even as of May, on our little chart here, you can see that emissions are already starting to go up. And we know that this is kind of the story in the wake of every kind of economic crisis that we've experienced over the better part of the last 50 years. Emissions tend to come roaring back as economies start to kind of quote unquote restart. The current forecast for the COVID economic slowdown is that we're probably on track this year in 2020 to see about a 5 to 10% reduction in global greenhouse gas emissions through to the end of 2020. So it's a short-term good news situation. The longer term, we're not quite there yet. But this is a really good kind of second interface between both crises. It's this centrality of time that's really, really important. The fact that flattening the curve actually matters a lot for both crises. Both have the potential to catastrophically overload our healthcare systems through acute events, and they may even pose an existential crisis to our species. So just as we're all kind of working to flatten the curve for COVID, the same needs to be true for climate change. But on a long enough time scale, our health system will face similar catastrophic shocks based on extreme events such as storm surges, fires, floods, prolonged heat emergencies, and of course, through the continued emergence of new infectious diseases. So certainly my colleagues in public health out west who a couple of years ago faced back-to-back worst fire and worst flood seasons would recognize that a lot of our systems are actually already surpassing surge capacity in the face of some of these extreme events. And it's these cracks that are continuing to be magnified by other acute crises such as COVID. So time is really of the essence here. Another interface is that, again, despite the fact that in a lot of places around the world, we've proved remarkably adept at flattening the curve and reducing that kind of surge capacity on our healthcare systems, we are still responding to a crisis that has significant equity implications. And another way to just putting this is that our most vulnerable populations are the ones who are most likely to be impacted. And so certainly in some of the work that I've done in terms of characterizing the equity-oriented kind of public health response to climate change, it surfaced the fact that these nuanced vulnerabilities exist within and between population groups. And the same is true of COVID. We talk about these things in generalities in terms of older adults, people with pre-existing chronic conditions, smokers, people experiencing various forms of socioeconomic marginalization and other forms of systemic oppression. But of course, that's not a true representation necessarily of the people who are always going to get sick from these things. And so we need to bring a degree of nuance and a degree of intersectional thinking to think about how some of these systemic disadvantages add up and put people more at risk than others, rather than just kind of grouping singular populations together. And certainly these are issues that serve as really significant reminders that our kind of work on health equity is really far from over. We're far from a world that's fair, equitable, or just. And it's been a point that's been made so intentionally by millions of people around the world in the last couple of weeks who have taken to the streets in recognition of some of those kind of systemic injustices, even in the face of potential exposure to COVID-19. Importantly, one of the things that I think that the public health on the whole was really slow to recognize as we were kind of implementing shelter-in-place orders and quarantine orders and physical distancing measures was that when we're really concerned about community transmission, and there's a huge pressing need for people to take action in the face of something like COVID, we really missed, I think, a few significant opportunities early on to ask ourselves really important questions about the implications of these decisions, especially for certain people and certain groups for whom sheltering in place isn't necessarily a safe option. And so what we're pointing to here is that we heard early on, a number of stories coming out from social service agencies talking about how, while crime is generally down, cases and reports of domestic abuse were actually way up in light of social and physical distancing measures. So if our home is unsafe, if our neighborhood is unsafe, if we don't necessarily have equitable access to the health conveying, the health benefits of going out and actually experiencing and being with nature, these things can have all kinds of undesirable land uses. And certainly in Canada and the United States and other parts of the world, this last point around kind of the inequitable access to the outdoors really demonstrates how the confluence of things like environmental racism and the citing of undesirable land uses, from what we know from the environmental justice literature, people who tend to be lower income, non-white populations tend to live in closer proximity to a variety of undesirable land uses and have differential exposure to environmental pollution. And so again, the question here is this right? Is it fair? Is it just? Given the circumstances, maybe, but what else do we need to be thinking about to ensure that we've got an equitable and appropriate and a fair response? So just to circle back to a couple of these kind of highlights, I'm going to complement a couple of these just with some more recent data. So in terms of scope of impact, as of this morning, I mentioned we hit 9 million cases of COVID-19 and more than 470,000 deaths. The UN expects the cost to the economy of COVID to be in the trillions of dollars. We've already seen trillion-dollar bailouts south of the border in the United States. Climate change comparably is estimated to cost just the health sector globally billions of dollars per year, with other sectoral impacts not included. So when we're thinking about things like disaster response, repairing infrastructure, et cetera. The World Health Organization estimates that already today, not in the future, something that we're already experiencing today, is 150,000 climate change attributable deaths every year. And that's just scratching the surface for a very conservative estimate. But additionally, the OECD has reported that heat-related deaths alone could cost upwards of $320 to $670 billion by 2050. And all of this has certainly prompted leaders around the world to not only emphasize how important climate change is, but the UN Secretary General Antonio Guterres several months ago now claimed that climate change devastation could be many times greater than what we're experiencing from the economic fallout of COVID-19. So both of these crises, they have a local to global impact, again, manifesting in really dynamic interaction with local conditions. They require a certain degree of urgency to address, and they have really significant implications for our most vulnerable. Yet I would argue that we haven't seen the kind of rapid action taken on a global scale to address climate change as we have of COVID. And it's probably, in response to the global nature of the pandemic, insofar as people feel the very high degree of urgency, whereas despite the fact that we know people are already dying from climate change, it's still viewed as this kind of long-term, slow-moving emergency, something that we have to worry about tomorrow. And really the challenge of that kind of thinking, the challenge of discounting the immediacy of climate change is that now conventional wisdom suggests that we've only got about 10 years to figure out how to suitably mitigate and adapt to the impacts of climate change to avoid catastrophic global warming. So there's obviously a number of other kind of overlaps and interfaces that we could talk about, and just in terms of how we define our policy response to both crises. Certainly another implication is how we plan for increasingly severe weather in a COVID-stricken world. This was a photo from Georgia a couple of months ago. It was ravaged by really extreme rainstorms, a huge storm cell that rolled through. It killed about 23,000 people in an area, didn't kill 23,000 people. This is at a point when COVID in the United States had killed 23,000 people. But almost 24 states at that time were kind of preparing for potentially record level flooding. And so again, you know, as we're here in Canada going through our flood season and quickly entering fire season, some really important questions being raised about what disaster response looks like and how we do that in a safe way, providing adequate physical distancing and adequate, you know, PPE to our first responders, but also to folks who are impacted by crises like this. And certainly, another really significant impact, and I'm really keen to hear about others from you folks on the call that you're willing to point to. But the last point that I want to make around these similarities is that both COVID and climate are just hugely demonstrative of our unhealthy relationship with the environment. And so this is a picture of a pangolin. It's one of the likely culprits that provided a reservoir for the virus to jump between animals and humans. The challenge is a lot of this is wrapped up in questions, really significant questions of equity. And we've seen in the media and in popular press, people arguing and debating around, well, why do we even have these markets in the first place? And the answer is that, well, a lot of people are living off of subsistence living, and just closing those markets has enormous equity implications for people to be able to feed their families and live their lives. And so it really raises some really significant and challenging questions for us to think through when we're thinking about what equitable responses to these crises look like. And the question that I always come back to is it just as easy as saying, well, it's about a question of treating all animals like we would treat humans, or are we talking about, you know, a deeper dive into a really esoteric theoretical territory around notions of interspecific justice, which is really to question justice for what and for whom, and how do we actually enter into some kind of relational conversation that recognizes that humans are not the center of everything that happens on the planet Earth. We're part of a very intricate, interconnected web of animals, and us included, non-human animals, ecosystems, environments. And so it's that interrelationship within these really complex socio-ecological systems that challenges us to come up with, quote unquote, the right response, because the right response is going to be different for everyone depending on your perspective. Now, fortunately, we've actually got a lot of different kind of approaches and learning that we've been able to cultivate over the better part of the last 70 plus years that really kind of, at least in the field of environmental public health, explicitly tries to link the health of people to the health of environments and ecosystems. And what I'm showing on the slide here is just a little bit of a brief timeline for the development of some of these key field developments. And it's not necessarily meant to be an exhaustive list. But it's a recognition that many of the kind of COVID and climate challenges have been taken up at length in the literature. There's a lot we know about the dynamic relationship between these two things. And certainly there's a lot that we can take away and glean from the way that these different kind of field developments position questions of multi-species equity or questions of host vector interactions. And so in some of the work that we recently published in the Journal of Epidemiology and Community Health, but also in a forthcoming book chapter for Human Security and World Affairs, what we've tried to do is distill some of the really kind of good, clear thinking tools from these emergent disciplinary developments and kind of asked how can they be useful moving forward. And three things that came out of this work were first, a really concerted focus that's emerged over the better part of the last 50 years to conceptualize the notion of nested ecological scales. So recognizing that whatever happens locally is going to have some degree of overlap and feedback with global conditions and vice versa. I've spoken a little bit already about the equity implications and how different orientations like eco-health and environmental health justice and political ecology of health really bring to the fore questions of what's right, fair, and just in our kind of planning, our responses, and our actions and practices in public health and global health work more broadly. And then certainly trying to think about how we recast really staid orientations towards host vector interactions and recognizing that many emergent infectious diseases actually result from unhealthy relationships with other species with whom we share our planet. So we need to find more innovative ways to be thinking about the nuance by which we're coming into contact with novel viruses and the conditions that either support that or limit the virus's opportunity to flourish. So what I want to do now is just having laid some of the groundwork to think about some of these similarities and differences, I want to talk a little bit about what this means for developing policies that respond to both crises. So again, we've proven that we can act quite quickly, that each of these crises has some overlapping features. And there's a question of what this means in terms of policy responses that are good for treating the fallout of both COVID and for climate. And one of the things that we hear ad nauseum in a 24-hour news cycle is this idea of bouncing back and returning to normal. Can we just bounce back? Can we just get over with this thing, get back to work, and head back to whatever the status quo was pre-COVID? And my response there would be, well, before we answer that question, can we really kind of push the pause button and take critical stock of what we're bouncing back to, and to really think quite carefully and critically about the type of world that we would want to return to, or whether we actually need to create a new world in order to achieve some of the goals that we've been talking about in terms of COVID and climate response. And so again, a couple of kind of key critical questions that I would ask is, well, was the pre-COVID global political and economic order, was it sustainable? And was that kind of normal, fair, or equitable? And I think that we know that it wasn't. And so when we're thinking about these kind of dual crises, certainly inequality and sustainability have been highlighted time and time again by both climate change, but certainly now also of COVID. It's been further brought to the fore. But we can see it certainly in terms of who is still able to work, who is still able to amass capital, and who is able to stay healthy. What's really fascinating about this whole picture and the intersection between inequality, climate change, and COVID is that the wealthy have accumulated an incredible amount of not only material wealth and control over global capital, and certainly that's been consolidated significantly even during the economic slowdown. But they've got significant power in terms of setting agendas for trade, development, and politics across much of the world. And so it means that a lot of people's interests are not necessarily being represented. It means that some people's existence is challenged even in terms of basic sustenance. The figure on this slide, the point that it's really making here is that in 2018, the top 9.5% of the population, that upper part of the triangle, owned approximately 84.1% of global wealth. And we know that the richest 10% of the people produce about half of the planet's individual consumption-based fossil fuel emissions, while the poorest 50%, which amounts to about 3.5 billion people, contribute only 10%. So there's a huge inequity in terms of who's actually creating the problem of climate change and who is most vulnerable to climate change's impacts. Building off of 40 or 50 years now of really robust social epidemiological evidence, we also know that equal societies fare better on almost all social, economic, and health outcomes. This is the thesis of Wilkinson and Pickett's book, The Spirit Level. But certainly, even in spite of that knowledge, we know that even in the last 10 years, inequalities globally have continued to widen. So we're now in a position where the world's 26 people own as much wealth as the bottom 50% of the global population. So the wealthiest own the most, have the most political influence, and they pollute the most. They also have the most to benefit from bouncing back to the status quo. So again, the core questions that we need to ask here: is bouncing back fair? Is it right? And is it just? In other words, what else do we need to be thinking about? Is bouncing back enough? Or can we ask the provocative question, how do we bounce forward? And the thing I like about this is a UNFCCC photo. The thing I like about this figure is that it indicates that our capacity to deal with disturbances or shocks to our system and the choices that we make are ultimately responsible for driving the outcomes. And so the challenge for us in both COVID-19 and climate change is to avoid the total collapse of a system and to avoid recovering worse off than we were before. And so as more people are kind of questioning the idea of recovering to a pre-event state, we're also kind of asking whether racing back to restart a system that requires, number one, significant carbon inputs, and number two, that largely only benefits the wealthiest in society, and certainly number three, is driving us unsustainably towards ecosystem collapse. Is this really a smart idea? And so the goal here is to start thinking about how we can recover or how we can transform our existing systems given the current economic pause, and to consider what our priorities are as a species moving forward. And so in the last couple of months, I've actually found great solace and comfort in the fact that suddenly everyone has, at least in my field, in the academy, everyone has something to say and something to contribute to COVID-related research and an understanding of what the recovery of COVID looks like. And through that, we've seen some really good, I think, kind of overlapping messages from kind of leading experts. This is a report that was coming out of Oxford that was just identifying, a variety of different kind of economic policy incentives that have, number one, a really good economic multiplier, which means that the value of whatever it is that we're implementing, say it's building a wind turbine, that it actually has other huge net economic benefits as a result of building that one turbine that far exceed the actual cost of raising it in the first place. And so some of the information that's being vetted out there by experts and trying to be communicated to decision makers, some of it's being taken up. Here in Canada, we've got the fledgling Canadian government task force on Canadian recovery. They're emphasizing a big shift towards building retrofits. We've seen as a part of kind of the CERB financing about $2.5 billion go towards oil and gas remediation of old well sites, for example. And certainly all of this is commensurate with the International Institute for Sustainable Development's call to quote unquote, build back better, which makes good economic sense. So we've also heard, I think, that, given the fact that we've got this really unique opportunity to push the pause button and consider what our next economy could or ought to look like, I was really drawn to this, a recent publication correspondence letter in Science that said one strategy would be to use recovery funds to stimulate innovation for the low carbon energy transition, but transitioning entire sectors is a long-term endeavor that requires continuous adaptation and attention to context, but that nations ultimately should not squander this opportunity. So I think we're starting to get there, and we're starting to see some really significant and concerted leadership from around the world. And that through this thinking, we're developing some really cool, innovative solutions that are attentive to the sustainability and equity dimensions of both climate and COVID. And so it's demonstrated that people actually have, a really robust appetite for progressive policy in times of crisis. So whether that's the South Korean incumbent government's landslide re-election, they ran almost entirely on an EU Green New Deal style COVID recovery that included, among a variety of other measures, a rapid phase out of coal-fired energy. Canada here, we had what was originally a 4-month targeted emergency response benefit program, the CERB, which has now again been extended, that like many countries could lay a foundation for a basic universal income or a living wage policy. Spain certainly was the first. Now in several countries that are kind of stepping up and saying, well, in the wake of COVID, what we're actually going to need is a really good policy to make sure that no one falls through the cracks. And we're actually going to implement that this recovery that we're slating out as a policy response is actually going to stay beyond what it takes to respond and recover from COVID. So all these are certainly examples of governments trying to reimagine our systems of social care in the face of new and emerging 21st challenges. But importantly, not all of these solutions are going to roll out the same universally, and they'll be really highly dependent on place. And so we need to be attentive to the diversity of interests, politics, and expectations of different regions. And certainly speaking as a Canadian, I know what's important out here in BC will not necessarily be the same as what's important for Alberta or out on the East Coast or in Quebec necessarily. And so that's where that kind of local to global thinking, that notion of recognizing that we live within these nested scales becomes really, really important. And speaking from some of the work that I've been engaged in over the better part of the last 4 years, working in the resource development sector, we really need to pay attention that whatever the green transition looks like, it has to be a just transition. We need to find ways that are supportive of transitioning a large number of oil and gas workers into well-paying jobs that kind of kickstart a green economy. So there's really, I think, significant opportunity in Canada to be thinking about new economies, and the government's getting there. It's probably a little bit slower than a lot of us would like to see. So whether that's attempts to focus on retraining, reemploying, what kind of job growth we might see in energy efficiencies, building retrofits, renewable energies over the long run. And if those can't necessarily replace existing jobs, then we need to make sure that we've got adequate social supports so that people don't necessarily fall through those cracks. There's a variety of other statistics that I could rattle off in terms of the kind of Canadian response, but I think I'm happy to save them and kind of just jump into a couple of other resources and closing thoughts that we can uh, create some room to discuss and hear from everyone else on the call. My big takeaway for today is that really what we require is a new meta narrative for how we're operating and how we live in a globalized society, how we move away from the ethos of consumption. And that narrative really desperately needs to build on stories of success and resilience at the local level, and really be oriented not towards the detriments that exist in communities, but to the assets, the unique kind of adaptation pathways that exist within and between different population groups. And we need to make sure that whatever our response is, that it drives that notion of our connectedness to place, our connectedness to our communities in ways that can foster future adaptive efforts in the face of emergent crises. If the get back to work message resonates, then we need to ensure that people are getting back to work as cleanly and greenly as possible. We need to make sure that our continued stimulus, and mark my words, where this is far from over in terms of the economic recovery, but we need to make sure that any investing that we're doing is investing in the long-term prosperity of our communities rather than the short-term gain for a few corporations. And we also certainly need to do this by refusing to bail out high emissions companies and request to bail out or refuse to bail out companies registered in offshore tax havens, or to refuse companies the ability to buy back what are now their heavily discounted stock. In Canada, we actually have a really compelling policy framework in the Green New Deal that could achieve many of these goals. There is a motion M1 raised by MP Peter Julian out here in British Columbia. It's now been signed by a number of different MPs from across the country and will be debated before the House. But again, whatever our solution is, we need to ensure that we don't leave anyone behind. And one of the reasons why I'm a huge advocate and supporter of that motion that Mr. Julian is bringing to bear on Parliament is that the language of that bill is really explicitly oriented towards leaving no one behind as we're thinking about these multiple transitions. So from a research agenda standpoint, there's a number of, I think, questions that are outstanding, and I'm really keen to chat about those with you in terms of everything from kind of the policy narratives that we need to start building to not only reach our broadest audiences, but also to start field testing different types of policy options that we think might be supportive of the type of future that we would like to bounce forward into. And certainly we're now starting to get little snippets of really kind of interesting fallout from the post-COVID economic implications. And a lot of people are getting really creative in terms of how they want to build new fledgling economies in ways that add value and meet these kind of the multiple challenges posed by both COVID and climate change. But most importantly, when we're thinking about and reflecting on that slide that I showed earlier of the kind of emerging fields in environmental public health across the years, we want to make sure that the lessons that we've gleaned over the past 70, 80, even 90 years in environmental public health in terms of how we holistically understand and appraise the myriad determinants of health, that we don't lose that thinking and just resort to our classic defaults of infectious disease control in a time of crisis. It's great that we've really managed, I think, well as a public health community internationally. We've learned a lot in the wake of this in this particular crisis, but we can't lose some of these broader lessons that we know, and largely tying back to the title of my talk, the notion that we have a very unhealthy relationship with the natural world and our planet. And we won't really be able to move the needle on emerging infectious disease or on climate change until we really start to engage with that question. A few more relevant resources just for those who are really interested in kind of the climate change and health space. I'm imagining that over the course of the next couple of years, you're going to see a lot more material that's talking about the interface between COVID and climate. Just a reminder that I'm part of the co-author team for the Lancet Countdown Report. We produce a policy brief for Canadian decision makers every year, tracking public health progress on climate change adaptation here in Canada. There's also a recently accepted paper. It hasn't been put out in the press yet. If you're really interested in kind of the equity interface between climate change and public health response, a new paper that we've published in the Journal of Epidemiology and Community Health. It's really looking at how do we move from beyond that vulnerability framing towards one of kind of assets and climate justice. It's a bit of a stay tuned. But worth sharing, I think, a couple of other resources and events. The first is just a primer that in 2021, Health Canada will be releasing their national assessment of climate change and health. This is the first kind of truly big national health vulnerability assessment that Canada's ever entertained. And I've been very privileged to work with my co-authors on Chapter 9, Climate Change and Health Equity. So again, another stay tuned for some really helpful resources, at least on the Canadian front. I mentioned earlier on, or at least it was on one of my, my disclosure slides, that the talk that I'm giving today was based on an earlier talk that was organized by the SFU Planetary Health Research Group. There's a really fabulous web series that I think is now in its 12th kind of episode. You can follow that web link for more information. It touches on everything from kind of climate change to Indigenous orientations around outbreak response, to the multi-species equity question, to social services. They've covered just about every topic under the sun. It's been a really informative, fascinating place to land. So I'd encourage you to check out their materials as well. And then finally, just a quick recognition that there will be a keynote address this year that I've been invited to give at CPHA, which has just recently been moved online, on climate change and the public health response in Canada. So for those of you at CPHA, I look forward to seeing you engaging there. But that's it for me. My final kind of message in closing is to stay safe, healthy, and as connected to nature as you possibly can. I know that I haven't left you with a lot of very small questions. These are really big, heady things that we need to kind of collectively wrap our energies and attention around. But I'm really happy to pick up some of these threads in our discussion. Thanks so much for allowing me to speak today. And I'll look forward to engaging any questions or thoughts that folks might have.
Thank you, Chris. This is really indeed food for thought. And I would be willing to either read your questions or comment in the chat, or you may ask me also to speak aloud. But please first mention it in the chat so I can name you if you want to speak, so that not 10 people at the same time will be trying to start talking. Yes, Jeff.
Hi there. Can everyone hear me?
Yes.
Okay, perfect. First off, I just want to say thank you very much for that excellent presentation, Chris. Rarely is it that I watch a webinar and I agree and shake my head so much as I did during your presentation. So thank you very much for that. My question is it's kind of two-pronged, but feel free to address whichever prong you prefer or both. I'm thinking in terms of what we can learn from our quick, rapid response to the COVID-19 global pandemic. What can we take what we learned from that and sort of apply it to address the environmental crises, which you correctly point out is as significant of a threat, if not greater. So that's the first thing I was thinking about while you were speaking, and I was wondering if you had any thoughts around that. The second part was around sort of mobilizing people, because I do think that there are some people who really strongly, very much see the importance of, as you put it, which I really like, not going back to where we were, but sort of bouncing forward. How do we bring more people on board? Because I feel like that's the challenge. I'm sure many of us have had various conversations with different people, and it's sometimes it's really hard to change minds. And so I'll leave it there. Thank you.
Thanks very much, Jeff. Great questions. Yeah, I mean, I've like all of us, I'm sure, sitting in whether you call it shelter in place or social distancing, gives you a lot of time to think about these really tricky, sticky issues. So in terms of your first point, how do we learn from the rapid response? For me, it's been a huge, I would argue, success story for public health. I mean, when you think back 10 years ago in the wake of SARS, a lot of the public health infrastructure that existed, certainly in Canada, but in a lot of other places around the world, like Singapore and Korea, in terms of testing capacity and rapid response, and really thinking deeply about surge capacity in hospitals and clinics and that kind of thing. We learned a lot, and we were arguably better prepared had we been, if we hadn't taken any of those actions. On the climate change piece, I've spent a lot of time thinking about what this means from kind of a communication standpoint. And I think, Jeff, to your point, there is an immediacy to climate change, but I don't think a lot of people recognize that immediacy. I don't think that from a public health perspective, we've done a great job communicating the urgency of climate change, because we know from survey-based research, most people still think that climate change is something that's 5, 10, 15, 50 years down the road. It's not something that I need to necessarily be worrying about. It might be something that maybe my kids or their kids need to be really kind of concerned with. And so it's that temporal dimension where, again, despite the fact that 150,000 people a year are dying of climate attributable deaths, we don't hear about it or think about it or see it in the same way or have the same visceral response to it as we have with COVID, where literally we're seeing piles of bodies because crematoriums are overrun and we don't have the capacity to actually move through and cremate that number of people who've died from COVID. Some really harrowing photos coming out from places like New York and Italy. So that communication challenge, I think, is really significant. I think that the other piece is that, like everything, I think COVID has become very politicized over the last couple of months. But on the whole, most people were really accepting of it. It wasn't necessarily, oh, COVID, good or bad, along partisan lines. Early on, people are like, this is really scary. There is this urgency. We're willing to give up a certain degree of freedom to deal with it. And I'm not sure that we've necessarily got there with climate change, because climate change has been politically partisan now for the better part of about 20 years. And again, we know from opinion polling data that there tend to be a variety of kind of different climate change oriented audiences that range from, deniers to people who are outright activists and really actively working on these things. So communication matters, but communicating to the context and your audience matters even more. I can't bring the same messaging to an audience in urban Vancouver around the need for sustainability as I can in Prince George, which is a pulp and paper town in northern British Columbia, and more or less resource development. So we need to be really kind of nuanced in terms of how we're communicating that urgency. Some of the things that we found, we've got a SSHRC-funded grant that's looking at climate change communication in the Canadian provincial north. So this part of Canada that's really characterized by rurality and remoteness and a high degree of reliance on natural resource development. And really what we're finding is that public opinion matters a lot when it starts to affect your pocketbook, right? So if folks were employed in kind of the pulp and timber industries, if their jobs are impacted by climate change because of catastrophic fires or an inability to plant species that were previously cash crops, all of a sudden they're thinking that's going to hit my pocketbook, and I ought to be a lot more concerned about climate change and willing to do something about it than perhaps I wasn't otherwise. On the mobilization front, just to kind of come back to your second question here, how do we actually mobilize and cause action? I think a lot of people have kind of taken inspiration, at least recently, from this idea of the 3.5% rule. And there's been a lot kind of being written about, really thinking deeply about how many people does it actually really take to change the world. There's some really, really kind of interesting and compelling evidence that suggests that about 3.5% of the population actively participating in protests would be enough to shift the political compass. And this is based from Erica Chenoweth. She's a political scientist at Harvard University, who talks a lot about civil disobedience and a lot about using empirical data and empirical evidence, how have protests actually moved the needle on certain social issues over the past couple of years. And it boils down in the one soundbite to about 3.5%. So the fact that people are taking to the streets right now, the fact that people are recognizing that there is this confluence from both COVID and climate change, and we need to do something about it, I think is demonstrative of the fact that people are mobilizing, and certainly decision makers are listening. It's been present in a lot of police service responses to the protests. It's been present in a lot of government responses to post-COVID climate change. So I think it's happening. The question is, how do we sustain that energy in a more or less productive way? And I don't have a good answer for you on that front, Jeff.
Thank you, Chris.
Thank you
I
very
do
much.
have a question here from Kelly. Ulfa is saying thank you for your engaging presentation. And she's wondering, what are your thoughts on COVID impacts on health equity for Indigenous people in Brazil? Your mic is not open.
Thanks, John. Yeah, my thinkings on the Indigenous situation in Brazil are a lot like they are for Indigenous populations elsewhere in the world. I think, again, we can make a lot of the same kind of observations in terms of vulnerability and equity and this bigger, broader context of our unhealthy relationship to environments. That's when we're thinking about the context and the spread of COVID-19. So in a lot of cases, what we're really talking about here is significant hundreds-of-year-old legacies of colonization and colonialism that are now kind of interfacing with a variety of other historical developments that have characterized either vulnerability or impacted adaptive capacity and people's ability to both self-govern and adequately respond in the face of crises. We've seen, some communities in Canada fare a lot better, but we certainly also know from more recent data that people of color and Indigenous populations are bearing a greater brunt of ill health consequences of COVID relative to their Caucasian counterparts. So again, the equity piece is huge here, and to the point of the question, for me, all of this ties back to the structural conditions under which people are getting sick. It's not just enough to necessarily always come in contact with the host, that kind of host vector interaction. There's a lot of things that need to go right for that, for a virus to kind of jump a reservoir, jump a barrier from an animal to a human. And certainly colonization and histories of colonization and histories of marginalization and systemic racism have created a number of opportunities that allow a virus like this to spread more significantly impact Indigenous peoples. So I think it's a hugely challenging problem. Of course, Brazil, I would argue, probably doesn't have the same kind of robust governance system and response that we've seen here in Canada, at least in terms of its attentiveness to that even being a problem.
Thank you. Again, those are not easy questions. I do not have any other questions so far, so maybe I'll go on with one of my own or questions, comment, because a lot of people, like what happened today, have compared climate change and COVID-19 and wondering why we can respond to one crisis and not to the other. But what to me is lacking maybe in the arguments is the difference between the two. And to me, there are two main differences. And the first one is climate change is because of humans. It's our fault. Coronavirus is the beast out there, an enemy we can strike and kill. And just a few analysis of the language used to fight COVID is testimony to that. That's one thing. The other thing is, for COVID, we're asking people to make a pause. In Quebec, it's been used, we're putting the province on pause for a while, so it won't last. But the changes we need to make for climate change are forever. So we need to make, so it really is not the same thing that people are being asked. On top of what you were saying in terms of the type of crisis and death and, that can be like climate health, climate change, death are hidden under a lot of other things. While COVID, it's okay, this is COVID cause. So that would be one thing. I don't know if you have any idea about that, but that, for me, changes the story, and our reaction to the crisis now is not necessarily a proof that we can react that way to climate change.
So I would agree with that last point, Johanne. I think that it is very enheartening and inspiring and very promising that we're seeing some really inventive and really creative approaches that are trying to kind of take a less than business as usual approach. They're trying to play around with more progressive policies and new actions and new priority policies in the wake of both of these crises that again kind of leverage that idea of co-benefits for both. The point that I would make and re-emphasize in my presentation, Jean, you had pointed out that climate change is really driven by anthropogenic emissions. COVID maybe less so. I still very deeply see them as the product of the same fundamental problem, which is a deeply problematic relationship between people and our environments. And certainly there's been a lot of analysis that despite the fact that these viruses are naturally occurring, they naturally occur in bat and pangolin populations, these coronaviruses. But again, it's the social context of this socio-ecological system in which we're living that is driving the ability of that virus to become a human problem. It's the fact that we don't have robust social safety nets in place, that really for people, the subsistence lifestyle might be their last resort. It might be the only way that they can make money and put food on their plate by virtue of increasing exposure to a variety of animals that might carry this particular thing and increasing the chances of that jump from species to species. So again, when we're thinking about kind of the overlaps, I think that you're right, that the symptoms are somewhat different and the responses are necessarily somewhat different because of the context. But that overarching context of a need to recognize our place within the natural world as being connected to everything else, for me is still kind of one of these central challenges that not everyone's wrapped their heads around yet.
Well, thank you. I have a comment here that I'm going to read from Evelyn. I'm sorry to be on first name basis here, but it's a lot easier for me reading people's first name. So hi, I'm particularly interested in the slide which mentioned funding farming in low and middle income countries. I have been raised in a small farming community in Ireland. It seems to me that a lot of my former neighbors are very concerned about the impact of climate change. However, policies have been developed and enforced, shifting them from more climate-friendly practices, while they also feel targeted by the climate change movement and unsupported by governments. This is also happening in the context of factory farming, which is driving their income down and causing small farmers who practice more ethical animal care out of the industry. It seems that these concerns are largely omitted from the climate change debate. I question the validity of alienating those whose lifestyles we demand change the most.
I agree completely. I think that this is, one of these central paradoxes that I pointed out in the presentation, that justice is a necessarily subjective term, and justice for me is going to look very different from what's right, fair, or moral for someone else. And I think that what we're pointing to here is this notion of whatever the transition it has to be a just transition. So if there are certain sectors that we know that contribute more to greenhouse gas emissions than others, for example, and the issue of farming has been raised, but certainly we could talk about transportation and the energy sector as well. We need to make sure that we're bringing all those folks along. And to the point from the person who's asked, I think it was Vivian who was asking the question, you're right, we absolutely cannot alienate people by saying, well, no, your industry is bad and you need to be doing things differently. I think that there's a lot of really good success stories of local farming being done in a more or less sustainable way. I think the Oxford paper, this little think piece that's being put out here, what it's trying to do is make the case for rural development in lower and middle income countries as an opportunity. And again, the big thesis that they're operating with, or the criteria that they're operating within, is to be thinking about economic multiplier effects. So what policies and things can we implement that we know will have a net spin-off that'll be above and beyond and much greater than just the dollar amount that we're investing today. And what they were kind of pointing to was that these investments in rural, particularly in low and middle income countries, around not necessarily the clean R&D, but everything else on this list can lead to this, some of the best gains in the long term. But completely agree with you. We really, this is again comes back to the point that I was making earlier around climate change communication, is that we can't even deliver a singular message to a singular audience, because we know that the audiences of climate change are very diverse, and there's a lot of different kind of orientations and takes. And so we need to be very careful about targeting our kind of core messaging around impacts and opportunities to be thinking about adaptation to those audiences and to their unique contexts.
Well, again, thank you very much for these answers. We are heading towards the end. It's almost finished. We promised people that this would be an hour. I'm certain that a lot of people would like to keep having a conversation with you. If we were in presence, we might head for coffee or something, but that's not going to happen. Well, it was very, very good on a personal note to see you, Chris. I think we hadn't met with one another since the last Cali conference.
Too long.
But
It's been too long.
it's been too long. So I don't know when it's going to be the next Equals conference. So maybe we can, when we can travel, we can find ways to diminish our travel but not stop them altogether.
There you go.
And so thank you again for participating. Thank you to my colleague in the working group for being there and agreeing that I host this one. Thank you everybody for being there. There will be a recording on this on the coalition website. And of course, join us for our next webinar. So bye everybody.
Thank you. Thank you. Thank you.
Take care.
Bye-bye.
You too. Bye.
Good talk. Thank you.
So,
Thanks very much, Chris and Joanna. Thank you. Excellent. Excellent.
thank you, David.